Hi, I'm Jared Thompson. I'm a doctor of physical therapy student at College of St. Mary, and I just want to talk a little bit about the opioid crisis and how physical therapists can help address it. For centuries, people have searched for ways to reduce their pain. In the 1990s, opioids became one of the most common solutions to treat pain, and drugs like oxycodone and hydrocodone were widely prescribed. And early studies falsely claimed that they weren't addictive. That led to a huge rise in use and eventually addiction. Um, we now know that opioids can be extremely dangerous. And just to go over some facts, patients who take them for just 18 days have about a 1 in 7 chance of being addicted a year later. And for those who use them for 30 days, that risk jumps to about 30% of addiction a year later. So that's definitely something to consider. Today, opioid overdoses cause roughly 220 deaths per day in the US. Um, so obviously, this is something that needs to be addressed, and we need to take precautions for this. Um, when prescriptions were uh, starting to get restricted to slow the crisis, many people were dependent on street drugs and turned to drugs like fentanyl and heroin, which were even more potent and deadly. So clearly, limiting prescriptions alone isn't enough to solve this problem. That's where physical therapists can step in. Uh, Physical therapists are trained to manage pain through safe and non-invasive methods like exercise, manual therapy, and movement training. Instead of masking pain with medication, we focus on finding and treating the root cause of the pain by improving mobility, strength, and overall function. I kind of like to think of opioids as a band-aid, for example. While opioids may cover the pain temporarily, they don't actually fix what's causing it. So kind of like a band-aid to um, where it can cover up the wound, but it's not necessarily going to fix it. It's just gonna kind of mask it. So that's kind of what I think of when I think of opioids. Um, this leads to over reliance on these drugs, as some may think it's the only way to resolve their pain, which is understandable because it seems to be like a quick and effective fix. But in reality, the drugs will wear off after each dose and could possibly lead to addiction and chronic pain if we don't take the proper precautions to let our bodies heal and look at the root cause of the pain. Physical therapy, on the other hand, gives patients empowering tools that work in the long term through practicing strategies to move better, reduce their pain naturally, and regain control over their lives. Physical therapists can also reduce the duration that patients are prescribed these opioids through these techniques and tools that are given to the patients. So um, instead of letting our patients, be on prescription for 18 days to increase their risk of long-term addiction, maybe we can reduce that to a few days, which will make a huge impact on reducing that addiction risk. Through education, movement, and individualized care, physical therapists play an important role in preventing drug dependency and helping patients find real, lasting relief without relying on opioids. But that's all I have. Thank you.